Assalamu alaikum student. Today our topic of discussion is ptosis. Basically we are going to explain this. First of all, today we will only discuss the definition of ptosis, the types of ptosis. In the next lecture we will discuss the signs and symptoms, clinical features and treatment of ptosis. Now, what is the definition of ptosis? An abnormal drooping of upper eyelid is called as ptosis. Our upper lid is coming downward. Basically, normally upper eyelid covers 1/6 of cornea, that is 2 mm, but in ptosis it covers more than 2 mm. If we will divide cornea into 6 parts, and normally upper eyelid cover only one part, 1/6 of cornea, upper eyelid. No, I want to tell you why ptosis takes place, why ptosis develops in our eyes, what is the reason of drooping of upper eyelid. Basically there are two muscles. Because of that muscles we are able to lift our upper lid in the upward direction. Which are these two muscles? Levator palpebrae superioris and Muller's muscle. These two muscles are responsible for lifting our eyelid in upward direction. Okay, both of these work when they get signals from brain through the nerves from the brain gives the signals to these muscles, then these muscles work and lift our upper eyelid in upward direction. Okay, any disease affecting them lead to ptosis. Because of any disease that defect these muscles, then ptosis takes place. Now we are going to explain the types of ptosis. Basically there are two types of ptosis, congenital and acquired. Now we will further divide congenital into 3 types and acquired into 4 types. Now first one is simple congenital, second one is blepharophymosis, third one is Marcus gun jaw winking syndrome. Now first one, what is first one? Here simple congenital, this is a developmental defect. You have to remember this. There is a developmental dystrophy of levator muscle. I have told you that levator is responsible for lifting eyelid in upward direction. There is levator muscle defect, developmental defect. Second one, occasionally it is associated with the weakness of superior rectus. This is also associated with the weakness of superior rectus. Second type of congenital ptosis is Blepharophymosis syndrome. Here we have to explain only two things: Telecanthus, Epicanthus. Telecanthus inversus, what is this? Increased distance between two inner corner of the eyes. Here our lid is downward, it's also down. There is increased distance between inner corner of eyes. You can say inner corner of eyes distance has been increased. This is telecanthus. What is epicanthus? An upward fold of the skin of lower eyelid near the inner corner of the eye. You can say near the medial corner of the eye. Okay, here there will be upward fold of skin of lower lid, but in this it moves in upward. There will be upward fold of lower lid near the medial canthus. Okay, this is telecanthus and epicanthus. Now third one is Marcus gun jaw winking syndrome. It is also called as congenital synkinetic ptosis. Always remember this is unilateral, it's never bilateral. I want to tell you how Marcus gun jaw winking syndrome. Here our upper lid will be drooped down. My jaw is closed. Now I will open my jaw. When I open my jaw, my lid goes to upward direction. It's mean our upper lid's movement is related to the movement of our jaw. Now, retraction of ptotic lid with jaw movement. I have already told you abnormal drooping of upper lid. In the ptosis, there is a drooping of our upper lid. It means ptotic lid is upper lid. When we open our mouth, when we move our jaw, then ptotic lid, it means upper lid moves in upward direction, otherwise it is drooped down. Always remember, this is 5% of all cases of congenital ptosis. Now we are going toward acquired ptosis. It has 4 types: neurogenic, myogenic, aponeurotic and mechanical. First one is neurogenic. I want to tell you the basic cause of neurogenic ptosis, why upper lid is coming downward. Basically, there is an innervation defect of muscles. The nerves supplying the muscles are not working, so muscles are unable to work properly. These muscles, basically third nerve palsy, third nerve misdirection and Horner syndrome. There is innervation defect of these muscles, innervation defects, and the nerves supplying these muscles are not working. Because of this reason of nerves not working, the muscles are unable to work properly. Myogenic. What is myogenic ptosis? Here is impairment of transmission of pulses from nerve to the muscle at their junction. In this case, because of these diseases, myasthenia gravis, myotonic dystrophy, because of these 2 diseases, the nerves, the impulses which travel from one muscle to the other muscle, from one junction to the other junction, because of these 2 diseases, there is any problem in traveling, in transmission of these impulses, impairment of transmission of pulses from the nerve to the muscle at their junction, because of these 2 diseases. Third one is ocular myopathies. It's clear from the name, there is a disease of muscles of their own, pathology of muscle itself affecting the muscles involved in lifting the lid in upward. I have told you that levator palpebrae has its role to lift the upper lid in upward direction. Here there will be defect in this muscle. It means it is a disease of this muscle that causes the drooping of the lid. Now, aponeurotic. What is aponeurotic? It's always remember, aponeurotic is called as senile because it is age-related atrophy of the levator muscle aponeurosis. Because of age, there is a dystrophy, atrophy of the levator muscle, because levator muscle is responsible for lifting the upper lid in upward direction. It's senile. It can also take place because of any surgery, after any surgery, because of detachment of the aponeurotic muscle from the normal position. There can be because of any trauma, there will be detachment of this muscle from its normal position. Because of detachment, the lids droop downward. Last and simple type is mechanical. Here it can be because of any tumor, any swelling or collision. It can also, you can say, collision. In word I want to explain the gravitational effect of a mass pulling the lid downward. That is any tumor, swelling or collision. It's basically any gravitational effect, any weight that pulling the lid in downward. This is mechanical ptosis. I have explained the definition and the types of ptosis. If you have any question, you can ask from me. In the next lecture, we will explain signs and symptoms, grades, clinical features, and the treatment of ptosis. Now I want to request you all of that please subscribe my channel, like, comment and share. If you have any questions, you can ask me. Thank you so much.